Delta Health Center, as an organization, is its primary goal is to provide health care to many people here in Mississippi Delta who otherwise would not be able to get that health care. And the most likely reason because they probably couldn't afford it. One of the major problems we had back 55 years ago when Delta Health Center was first established, it was established here in Mountain Bayou in an area that was extremely poor, basically 100% black, who had no access to health care. And if Delta Health Center had not come to this area to help people, then those people would have had to do without. Now, unfortunately, some of those things still exist even today. We have still a large number of very poor, uneducated people, and they're not all black now. There's some black, Hispanics, and whites. And the good thing about Delta Health Center, it provides care for all those people, regardless of their ability to pay. That when a person goes to see a doctor, to a medical clinic, the very first thing they look at is that person's ability to pay. And the great majority of the time, if that person does not have the ability to pay, many of those times they're going to be turned away. And if they owe a bill, they have to pay that bill before they can be seen. And sometimes they force them to pay for that visit before they can be seen. Well, Delta Health Center doesn't do that. Obviously, Delta Health Center needs and wants to be paid as well, but Delta Health Center is not going to turn you away because you cannot pay your entire bill or because you owe some money. Well, Delta Health Center has always provided for the basic needs of its patients. Looking back in history, back in the 60s and 70s, a big part of that at that time was care for pregnant women and children. This care was not available to poor black people otherwise. And I can say that because I was born here in Mount Bayou. And some of my older siblings were born at home by midwives. I was born here in Mount Bayou at a clinic/hospital, which preceded Delta Health Center. And so at that time, it was mainly prenatal care, children, etc. Today, it's more comprehensive. We provide those services, but we also provide services for the geriatrics, the old people, the disabled. And many of these people, again, would not have care because they can't afford to pay for their care today if there was not for Delta Health Center. We have a tremendous obstacles in our future. When we look at this moment, we're still dealing with the coronavirus pandemic. And that's just what we see at this moment. And that has been very tough. As you know, we've been into it 2 years, and Delta Health Center was at the forefront of first testing for the virus, treating for it, and now on a daily basis we give vaccines to try to prevent or to try to stop this pandemic. Now, the future, it's of course it's unpredictable because we don't know when the next pandemic, virus, bacteria, whatever will come along. But the key is to be prepared, and preventative care will always be in vogue. And when I say preventative care, we're talking about nutrition, exercise, and treating for those chronic diseases that permeate throughout society: high blood pressure, diabetes, obesity, and of course cancer. So the challenges are many. But for those of us who love what we do, and as I said earlier, I've been a doctor for over 40 years, so I love what I do. And it's a challenge to me to deal with these problems. And my goal is to educate people and to help them to achieve improvement in their health care.